We lost your signal there, Doctor. Talking about, we just had another holiday weekend, and looking back at Memorial Day weekend, now that we're several weeks out, did we see a rise in hospitalizations and cases from Memorial Day weekend? And what do you think that may mean for after this 4th of July weekend?
Yeah, I mean, I think overall the virus is in this expansion period in general. We do have people going out and doing things, whether they're large bars or other gatherings. We know that Dr. Fauci said a couple weeks ago that the surge and the continued cases that we were seeing were due to Memorial Day 5 or 6 weeks before that. We know this is just a continuation of that, not so much a surge, but just a continued expansion of the virus because of several things. Obviously, the irresponsibility and the gatherings, the no face coverings, that contributes a lot to it. There's also a lot of younger age groups that are getting infected and spreading it to their families as well. I know in the hospital this weekend while I was working, I had seen at least 4 new cases of people in the hospital in the ICU. So unfortunately, it continues to be out there and spreading. We really need to continue the physical distancing and the mask and the hand hygiene to really decrease the amount of spread as much as possible so that we don't have to overwhelm our health care services like they've done in New York, like they're doing in Houston and other parts of the country as well. So overall in the city, yes, I believe there is a large expansion. There are new cases every day of this disease.
And Dr. Hawkinson, speaking of masks, you know, just yesterday, Kansas Governor Laura Kelly said that there are 7 clusters in the state directly related to bars and restaurants and none related to nail salons, barbershops, or other close contact services. So if you are going out and eating, should you be wearing a mask until the exact moment you get your food, or should we just be avoiding those spots altogether?
You know, I know personally I haven't eaten indoors at a restaurant, but I think that certainly the employees of the restaurant should be wearing masks. Obviously, the patrons should be wearing a mask until that time that you can't when you are eating or drinking. And if you can do it outside, absolutely do outside. I think that it is absolutely great that there haven't been any cases in those other places like nail salons or hair salons. You know, those people, those employees, those owners of those businesses, it is vital for them. So they are taking the utmost precautions, and we've seen that that has had dividends. We know that there was a group of 1 or 2 hairstylists in Missouri who had COVID-19, but they didn't spread it to 130 or 140 contacts because both parties were wearing masks, even though they are in close proximity. So that's good anecdotal or case evidence that this works, and if everybody can do that, we'd have a much easier time at decreasing the spread of this disease.
Dr. Hawkinson, as always, thank you so much for joining us. We'll be right back.